Welcome to WSIC Dashboard CYP Risk Segmentation Radar demonstration video. Those with patient-level access can find the dashboard under the Patient Selection product and by clicking on the CYP Risk Segmentation icon here and here. The CYP Risk Segmentation Radar is a dashboard which allows professionals within secondary care, primary care, community and social care settings working with CYP to understand the level of risk and complexity of children and young people. It allows the user to order, group and filter individuals according to a range of different criteria, some relating to the level of risk and some to the level of activity individuals have had within different service settings. Users will have the option of selecting Health Borough Practice Network or PCN where a legitimate relationship is present. The provider filter gives an indication of which North West London hospitals are the main acute provider for any CYP patient. This is based on acute activity over the last 2 years. The patient segment filter is another very useful filter to enable the user to select cohorts of individuals with particular health needs to proactively target vulnerable patients and manage them effectively. The age band filter allows the user to segment the CYP population into smaller age ranges. The care plan filter allows you to filter those with or without a care plan or those with an outdated care plan. The risk segment filter uses an algorithm which segments the population into specialty, high risk, rising risk and stable risk based on a number of different factors. The algorithm involves segmenting the population into groups of people with similar needs to enable targeted intervention for those population cohorts. The tool is designed to support the development of health and social care services to enable them to take a population-based approach to improving health. Please refer to the user guide for more information. The sort by filter is another very useful filter which allows the user to sort patients that fall into any one of these categories to the top of the dashboard. This number reflects the number of patients based on your current filter selection. If you only want to focus on the top 100 or 50 patients, you can do this by changing the number here. For the purpose of this demonstration, I am going to narrow down the list size by selecting one of the health boroughs within the health borough filter. On the left-hand side of the dashboard, you'll be able to see patient details followed by the current risk segment and their previous risk segment. Following a dashboard refresh, the previous risk segment column will update to reflect an equal sign, an upwards arrow sign, a downward arrow sign, depending on whether a patient has moved up or down from the previous quarter. Please refer to the user guide for a more detailed explanation. It's also important to note that the dashboard does not include well patients. Emergency attendances within the last 6 months include accident and emergency, urgent care centre, walk-in centre, and minor injury unit attendances. Similar to that of the non-elective admissions, both key care processes will reflect a red indicator if an individual has had 3 or more A&E attendances or non-elective admissions in the last 6 months. An amber indicator if an individual has had 1 or 2 attendances or admissions within the last 6 months. No emergency attendance or non-elective admission will reflect a blank indicator. 100 or more GP visits within the last 6 months will reflect a red flag. 99 or less, a grey flag. GP visits are not GP appointments but reflect GP coded values during a GP consultation, such as onward referral, blood test requested, a prescription administered, etc. Administrative events are excluded from this count. A red flag under the was not brought indicates 1 or more DNAs within the last 6 months. A red indicator within the known to mental health column reflects that an individual was seen within an acute or community mental health service or has had an acute mental health inpatient or outpatient activity. Number of LTCs counts the number of QOF long-term conditions within a patient's file. The sort by filter will allow us to sort any individuals that fall within any one of these categories to the top of the list. A red flag for asthma indicates a patient has had one or more asthma admissions, no recent asthma review since the last admission, and has had a steroid prescription. An amber asthma flag indicates a patient has had one or more asthma admission, no recent asthma review, and been prescribed a steroid prescription. A green asthma flag indicates a patient has had a steroid prescription and a recent asthma review. A blank flag for asthma indicates a patient has had an asthma admission but has good inhaler technique. An unknown asthma status will reflect a red indicator. An obesity flag is based on the age and BMI of CYP. A red flag can also indicate an individual has an unknown BMI, as well as a high BMI. Hovering over the indicator will allow you to see the difference amongst those who have a red flag for a high BMI versus those with a red flag because their BMI is unknown. Whilst the grey flag indicates a BMI value outside of the agreed parameters. A green tick under other LTC indicates an individual has a long-term condition other than asthma or obesity. For a list of long-term conditions, please refer to the CYP risk segmentation user guide. A green tick under this column indicates a patient has complex health needs. A green tick under care plan in place indicates an individual has a coordinate my care plan in place. A red cross indicates an individual has an outdated care plan, and a blank indicator signifies no care plan in place. Hover over any of the indicators on the dashboard and select Click here for Patient Summary to access the Integrated Patient Summary dashboards, which consists of patient spend, GP activity, GP prescriptions, social care, acute diagnosis, acute procedures, and the patient profile dashboard. The current page consists of the patient summary page, which displays patient activity within different service settings over a period of time. Hovering over the swim lines will provide the user with useful information regarding the activity. The refresh date can be found in the purple banner on the right. Hovering over the eye icon will display the current and previous risk segmentation dates, and selecting the download option on the top right will allow users to print a PDF or CSV Excel document based on their current filter selection. More information on how to print can be found in the CYP user guide. Users of the dashboard can now address local population health needs, order, group and filter patients according to a number of different criteria, identify rising risk and high-risk patients who would benefit from proactive care to improve the health and well-being of CYP in their local area. Dummy data has been used throughout this demonstration video. For more information or for feedback on the WSIC dashboards, please contact nwlccg.wsic.dashboards@nhs.net. Thank you for watching.